By getting involved in advocacy and policy earlier in your career, it has all the more ability to amplify the impact for patients.
That's Dr. Haley Simpson with the University of Colorado. We'll hear more from her later in the show. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Policy and advocacy play a critical role in improving the quality of cancer care, and oncology fellows are uniquely positioned to get involved early in their careers. Our first guest shares reflections from her own time as a fellow. Dr. Katherine Baker joins us from Tennessee Oncology.
I'll just start by saying I just graduated less than 6 months ago from fellowship at Vanderbilt and was definitely very involved in policy and advocacy, especially during the later years of my fellowship training. And the reason for that is because I think that earlier in your career, especially during fellowship, it's really natural to get deeply focused on mastering the clinical details of treating cancer, because that's what we're there to learn, as well as managing individual patient cases. But to me, it was also really important to take a step back and understand the larger healthcare landscape that shapes how we care for cancer patients on a systemic level. So getting involved with advocacy during fellowship gave me an opportunity to explore that bigger picture and understand how policies impact patient care, patient access, and outcomes.
Did you feel like you made a difference by engaging in advocacy?
Yeah, I've been really fortunate to engage in several meaningful advocacy efforts. One experience that stands out was during my second year of fellowship when I participated in the American Society of Hematology's Advocacy Leadership Institute in Washington, D.C. This was an amazing program. It was invaluable for understanding how effective advocacy operates and gave me a lot of the practical tools that I now apply to my advocacy and policy efforts. Another more recent impactful moment was joining the Community Oncology Alliance's advocacy efforts to address the Stark Law FAQ, which was an FAQ that restricted oncology practices from delivering medications directly to patients. This restriction posed a significant barrier to care, and seeing advocacy efforts pay off when a bill to rescind this FAQ passed the House was super fulfilling. I had the privilege of going to Capitol Hill with Community Oncology Alliance immediately after this bill passed through the House. We're hoping it passed through the Senate. And I got to meet and thank the legislators that helped make this change possible. So that was a really powerful reminder of the impact that we can have on policy when we come together for a common cause.
You're in a state society policy committee. Tell us a little bit about that.
Yeah, so I'm a board member on the Tennessee Oncology Practice Society, and we recently underwent a restructuring of our board to create focused subcommittees on education, advocacy, and outreach to allow us to be more effective in each area. And I'm currently serving as the chair of the advocacy subcommittee, where I work with a smaller group of dedicated board members, as well as our lobbyist, Courtney Atnip. And together we identify our key legislative priorities that are going to impact oncology care in our state, and then also strategize how to advocate effectively for those issues. And being in this role has given me such an incredible opportunity to be directly involved in shaping policies that improve cancer care for patients across Tennessee. And that's been incredibly rewarding. Our team is very committed to advancing policies in oncology that are going to be incredibly meaningful to our patients.
Is there anything you wish you knew when you first got involved?
Yeah, so early in my training, I don't think I fully realized just how many systemic issues directly affect cancer patients and require dedicated advocacy. Issues like PBMs, step therapy, prior auth, and others that significantly impact access to timely and effective care. As I mentioned, I really didn't get deeply involved in advocacy work until my second and third year of fellowship. I just wish that I'd gotten involved in advocacy even earlier, maybe even in residency, to develop a deeper understanding of these challenges sooner. Another key lesson I would say I've learned is just how complicated and political the government process can be. I think even when an issue seems like it's really straightforward from a healthcare provider's perspective, it's not always as clear to legislators who have to weigh competing interests and perspectives from multiple different stakeholders. So advocacy involves not only presenting the clinical perspective, but also understanding how to effectively communicate impact on patients in a way that resonates with lawmakers. And that's a recent insight that I've had that's been invaluable in learning how to navigate and influence policy for the benefit of patients.
Has participating in advocacy helped you better care for patients?
Yeah, I mean, I think that getting involved at an early level has given me a much clearer view of the systemic barriers that can obstruct patient care. And for me, understanding these challenges firsthand has deepened my empathy for patients who face issues like prolonged waits for medications because they're waiting on a prior auth, or hurdles and delays in accessing biomarker testing, all of which is essential for selecting most effective cancer treatments. And seeing beyond individual cases to these broader patterns has empowered me to advocate not only for my own patients, but also for systemic changes that can improve care for all patients.
How can oncology fellows collaborate to help advocate for their future patients?
I think it's critical that oncology fellows engage with organizations, both state level societies like the Tennessee Oncology Practice Society, as well as national organizations like the American Society of Hematology, American Society of Clinical Oncology, or Community Oncology Alliance. I think coming together with these groups offers a powerful platform for networking and then also provides structured opportunities to connect with peers who share common goals. So I mentioned the American Society of Hematology Advocacy Leadership Institute. ASCO has a similar program. COA has opportunities for fellows to engage with policy and advocacy. To me, forming coalitions through these organizations is essential for driving meaningful, long-lasting policy change, as collective voices are often much stronger and more impactful than individual efforts on your own. And I honestly don't think as a fellow, it would be possible to even know where to start on your own. So you really need to get involved early and build relationships across states, across practices, and then you can help lay the groundwork by doing that to form partnerships that will ultimately benefit your future patients.
You heard from Dr. Haley Simpson at the start of the show. She's here to bring us up to speed on how to get involved. Dr. Simpson joins us from the University of Colorado.
So I think now is the perfect time to be getting involved in policy and advocacy if you have not already become involved. I have medical students that I've mentored that are getting involved early on in medical school, even first year in medical school. And I think that's a great time, but also whenever you come to it is the right time for you. And the reason I say now is the best time to get involved is because our political system is making policy decisions which impact the healthcare system now. And these policies are influencing how we practice medicine. So I think it's extremely important that we have a say in it.
What would you say to someone who's a little bit hesitant to get involved?
I think this is a great question because we often feel in medicine that we need to be an expert in something, that we need to learn more before we can share anything about it. And that is really important for the jobs that we do. But the policy sphere is a little bit different. I would say, firstly, you don't need to be an expert. You already have an expert opinion because of your training and experience. And politicians, they're not hesitating to get involved in policy discussions on topics on which they are not experts. You should get involved, express your opinion. You will learn something. You might change your opinion or the way that you express it, and that's all fine. That's part of the process. You'll learn as you go. In my experience, I started advocating for equitable access to medical care for patients who were uninsured. And when I started that, I did not understand the insurance system at all. I just knew that there was this deficit in care that my patients were getting. So I started exploring that, and now I know quite a bit about it just because of this experience.
What's the best way for a new fellow to get engaged in these issues?
So there are a couple of excellent places that you can start, and our medical training often doesn't prepare us for the sphere of advocacy and policy work. So you will need to look for training often outside of traditional medical education for this. One of the ways to do this is find a local or national professional society with an advocacy agenda. For me, I've used Rocky Mountain Oncology Society, or ARMOS, and I got involved in that professional society. It was free for fellows to join, and it's relevant to the state of Colorado, but your state may have another similar organization. And I started participating in the policy committee, and I've been working with that organization for a few years now, and I'm going to be the chair of the policy committee coming in January. Another organization that I've personally utilized is ASH, the American Society of Hematology, and I know ASCO has similar projects. So these are some places to get started and build your network. At my institution, I've also explored connections with other departments. For example, the Department of Internal Medicine has been investing in advocacy, and they recently hired from another local hospital a doctor I've been working with, Dr. Lilia Cervantes. She recently won the Bernard Loan Award for Health Equity. She's an internist, and she has a heavy interest in advocating for health equity for underprivileged populations and improving representation in medicine. And she's been an outstanding mentor. And I'm certain that she has many colleagues around the country who are similarly passionate about these topics and would make excellent connections. And if you ask people around your institution, I'm sure you'll come into contact with them.
How have you seen advocacy directly impact patients?
So by getting involved in advocacy and policy earlier in your career, it has all the more ability to amplify the impact for patients. So to back up, I realized when I moved to Colorado, I was taking care of patients in our hospital. And I realized that not all of our patients had the same access to opportunities for treatment. They were uninsured patients. And when you're not documented, or if you have moved to the United States legally and are on a green card but have not been here for 5 years, you cannot enroll in any of our public health insurance systems. And these patients, I first came into contact with them when I realized they weren't able to enroll on clinical trials. And since I wanted to dedicate my career to translational research, I was immediately uncomfortable with the idea of building that career and improving treatment options for patients while denying that access to other people. I began to realize that patients were not only not able to get the most current treatments or have opportunities to access clinical trials, but also they couldn't even get standard of care treatment. They couldn't be scheduled for outpatient chemotherapy. And in an area of personal interest to me, they couldn't get a stem cell transplant for hematologic malignancies. So I started building the network and then having meetings with people from the governor's office, the healthcare policy and finance division, and state representatives. And this ultimately led to an update in the Medicaid billing manual and new healthcare policy that improves access to healthcare services for uninsured and underinsured patients in Colorado. So this has had a direct impact on patients' treatment. And I've seen that in the patients that I'm caring for. We've enrolled patients on clinical trials that never would have had the ability to enroll in those trials before. And this has had the positive effect of also increasing representation on those clinical trials. So actually, advocacy has felt like one of the most direct ways in which I've been able to help my patients.
What advice do you have for fellows who are just starting?
So the number one piece of advice I would have is that you are the right person to advocate for this issue. And I struggle with this myself, thinking, am I the right person for this? I haven't experienced it personally, but you are the right person to advocate because you care enough to actually do it. There may be other people who look like they have better credentials on paper, or maybe they have more experience with advocacy than you do. But if you care about something and you want to make a difference, then you're the right person to do it. You can collaborate with others, help support them, and they'll help support you. You can amplify their voices, and you do know enough to be impactful because you care enough to learn it.
Is there any advice you'd like to leave with your colleagues today?
So I think one hesitation that some of us have when we think about getting involved in advocacy, and this is also something that I personally experienced, was I had this hesitation as being seen as partisan or biased. And in medicine, we traditionally are encouraged to be seen as impartial. So I had this hesitation that participating in advocacy could be seen as partial in some way. But my thought on this pivoted a little bit, seeing some of the decisions that were being made through politicians who don't have a solid understanding of the healthcare system and medicine and science in general. And I thought, even if I'm not the perfect person to be speaking up about this, then at least I have some perspective that can be seen as valuable. So I think it's extremely important that if we see something and we're not comfortable with it coming through the political system, that we speak up on that on multiple levels. And that could be from thinking of your own policies and advocating from the beginning with local offices in your state. It can be writing letters to your representatives or calling them. It can be showing up to speak about, to testify for bills. It can be writing letters or opinion pieces, publishing viewpoints or personal perspective pieces in medical journals or in popular magazines or newspapers. These are all ways that we can get our thoughts and opinions out there, and it does matter that we do that. This is the opportunity for us to have our voices heard in this political system.
Thank you to our guests today. You can take a look at the show notes for more information on the need for fellows in oncology advocacy. Share this episode with a fellow in your community, and make sure to tap the plus icon on your screen to follow the show. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.